Medicine can be complicated and intimidating. Well, no more. Here is Rock Doc, Dr. Stephen Eskin, who teaches his patients about medicine through music. Check it out. Dr. Eskin, I've been doing the show a long time. Some interviews I'm excited about, some, cool. This one I'm like super pumped about. Yeah, man, this is a great one because you are an interesting cat. We're going to talk about all the cool stuff you do, but first, let's cover some medical stuff real quick, okay? You are a gastroenterologist, which
Correct.
I've been practicing for a while.
You did great.
We'll start with this. For people who don't know, an ulcer, what is it? How do you prevent it? How do you treat it?
All right, well, gastroenterology is the study of all digestive systems, okay? And that includes what I call the stuff that's within the tubes and the stuff that's outside of the tubes. The tube being the thing that starts at the mouth and ends down there.
Gotcha.
And all the stuff outside of the tube would be like the pancreas, the liver, the gallbladder, things of that nature. An ulcer is something that, of course, is inside the tubes. It's inside the stomach or inside the small intestine. Those are the most common locations for them. Ulcers are caused by a number of things. They can be caused by bacteria. There's one in particular called H. pylori, which is very common, especially in tropical countries. It is diagnosed either through a blood test or a breath test or a stool test or a biopsy when we do an endoscopy. We also have other ulcers that can be caused by, let's say, ingesting too much anti-inflammatory medications like ibuprofen, things of that nature. And of course, there are nasty things that cause ulcers, like malignancies, which will actually burrow through a stomach lining and cause an ulcer.
Right. None of these sound fun or
They're
pleasurable
not
or enjoyable. A couple more terms, and then I want to talk about how you educate people on this stuff. I've heard of GERD. That's like acid reflux. Is that correct?
Gastroesophageal reflux disease, exactly.
Yeah. That also is no bueno.
No.
And IBS. Yeah.
Very common.
Yeah. So, what are some things people can do to notice, symptomatically that they have these things, and maybe to treat them as well?
Well, the nice thing about GI problems is that they're usually not that subtle in their presentation.
Sure. Okay.
Yeah, there is such a thing as silent reflux. A person can get reflux only at night. They might wake up in the middle of the night suddenly feeling even short of breath because that means that acid has come all the way up and gone down into their pulmonary tree, which will of course cause coughing and hacking and shortness of breath in the middle of the night. Heartburn is a typical symptom for reflux, abdominal pain for ulcers, and usually, as I say, these things will generally reach a point where a person is dealing with them on a more and more frequent basis. And at that point, they usually come to see me.
Okay, and when they see you, sometimes you have a white coat. Sometimes you have that cool coat that says Rock Doc on it.
Yes.
And when you are the Rock Doc, what are you doing?
Okay, when I'm the Rock Doc, I'm basically speaking to a large group of people. I'm usually singing to them about a lot of the medical problems that they deal with or things that they haven't dealt with yet, but in order to give them the information to process exactly what they might feel might mean.
Okay, and how did this come to be?
Well, when I was back in medical school, I noticed that I needed to memorize a huge volume of information. And one of the ways that I did it, I was a lifelong musician. I began as a drummer when I was about 7 years old. And by the time I got into medical school, I discovered that it was really kind of helpful to use mnemonics in the form of little skits and songs that I would write for myself. Like, for example, the branches of the facial nerve, things that I would have to memorize. So like 10 zebras bought my car. So the temporal, the buccal, the zygomatic, the mandibular, and the cervical branches of the facial nerve.
Okay.
So I reasoned that this kind of thing could be used for the general public to educate them as well, because people really need to have a reflexive sort of approach to something that they're feeling. Otherwise they panic.
Yeah.
Panic is the mind killer.
So how does it work? What do you just go to schools? Do they hire you out for weddings and bar mitzvahs?
Well, weddings and bar mitzvahs, I generally, after having Nagila, I go right into some blues on asthma. No, I'm kidding. But generally schools hire me out, health fairs, museums, and I also have an adult Rock Doc program, which is a little bit different. It's a little bit more focused on one topic at a time, generally speaking. I go into businesses, educate about screening tests, also all through music, and You know, I mean, I still use the ABC melody when I can't think of what comes after K, you know. So.
Yeah. Yeah, no, look, you're right. I mean, mnemonic devices and things of that nature, we all use them.
Yeah. It's not really that novel of a thing, only approaching it, using it for medical and health literacy. That's where it's new.
Yeah, completely. And what is your feedback when you go to these things?
It's excellent.
I would imagine,
always,
yeah.
Always.
Do people hold up their cigarette lighters as you're,
Well, no,
as you're doing a
because,
song about lung cancer,
well,
maybe?
you know, that's actually when they put them out.
Right.
It goes dark in the auditorium.
Yeah. And then do you give away CDs? And
I do.
Yeah.
I do.
Yeah.
I sell them. I give them away. There's T-shirts. There's all that nice stuff and little pins and stickers and all that good stuff for kids, as well as I have a book that I've written that people can download. It comes in kind of modular forms on different topics. That's for the adults. Mm-hmm. And, that's pretty much how it goes. It's mostly, though, it works best in the venue of a school assembly. That's the best, because these kids think that they're going to hear a boring lecture, and the curtains of the auditorium peel back, and there's a rock band and shiny electric guitars.
Right.
It grabs them right there.
Because I asked you before we started this, I was like, is it just you and an acoustic? You're like, no, man, it's electric. Yeah. I got a band behind me.
Absolutely.
Yeah. It's legit. You're like opening for the Rolling Stones. Going out to,
yeah.
I mean, maybe Keith Richards could use a few songs about medical
only
health.
when he's in the dialysis unit.
Right, exactly. So, all right, so this is so cool. If people want to get more information, hear your music, book you up, how do they do it?
www.rocdoc.com.
Okay.
And all the information is there, how I can be reached, so they can book a concert, calendar, events, media, all kinds of good stuff.
Oh, do you have a favorite song that you've created?
It depends.
I won't make you sing it. I'm just curious.
Well, there's a song that goes over really well in South Florida. It's a little kind of a salsa tune called Sammy and Marco, which is about the ABCs of cardiopulmonary resuscitation. And it gets very good feedback.
All right, well,
here.
Sammy and Marco.
Yeah, but it's all in different styles. Okay, there's reggae tunes. There are straight ahead rock and blues. Because if it was all the same sound, then you wouldn't remember it. It would all sound too much alike.
Can you beatbox and do some hip hop on your own too?
You
working on that?
Let's say I'm working on it.
Right. Well, when you get that, come back and you can premiere it, debut it here.
All right, sounds great.
It's good to meet you.
All right, great to meet you.
You got it.
Thanks so much.